Welcome to the CodeCast Podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the CodeCast Podcast today. My name is Terry Fletcher. So today, I'm actually going to look at CPT coding 2025. I don't want you to be left flat-footed, and make sure that you're not in for any surprises if you haven't taken the cellophane off your new CPT book yet. For those of you that haven't even ordered your CPT book yet, you need to. I would go through APC. It actually comes really fast, and it actually is one of the more inexpensive ones. You can go through AMA, but they're a little more expensive, and I know other companies sell it as well. But make sure you get the actual CPT book and not a generic version, because when you are appealing claims, when you're looking for specific code language, directions, and having the actual AMA version of the CPT book, you'll have more credibility when you're trying to make sure that your published guidance is appropriate. Okay, it also comes color-coded. There's references in the back, and you just really need the brand name on this one. So I see some people using generic, and then they don't have the same page numbers, and it kind of becomes a mess. So just making sure that you have what you need. So let's take a look at what we're in for. And I'm just going to briefly just kind of tell you what's going on without giving you any Medicare information or payer information. This is just coding. So and again, I don't want you to let the code changes become a surprise for you come January 1st. So we have not only new codes, but we also have revised codes and deleted codes. And before I say anything else, when we look at new codes, that means newly added codes that have either been a brand new CPT Category 1 code numeric that's been added to the book because the AMA subcommittee has decided that it deserves a code and it doesn't need to be a new technology yet, or it was a code from the T code section that either was what they call, and I'm air quoting, sunsetting, and now it can be converted to a Category 1 code numeric from a T code, new technology, and they put that in the new code section just so you know it's not considered revised. And then we also have revised codes. Revised does not mean the numeric section of the code or the numeric part of the 5-digit code is changed. It means that part of the language or description of the code is what has been revised. It could be as little as a semicolon or a colon. I know something in the EP section, electrophysiology, since I do a lot of cardiology, it was interesting. They actually changed like the word "the" from "with." I mean, just little things like that. I had to read it 5 times just to find the change. I'm like, oh my gosh, I cannot see it. And I finally saw it. And then I always want to make sure you know that deleted codes should not be deleted from your system. Just make sure that you put something in your file maintenance and the hard drive that says do not use, and put the date, do not use 2025. Because if you have that on somebody's record, in somebody's ledger, in somebody's chart where you've sent out a claim in 2024 or previous, and you have to rebill it, and all of a sudden you don't have that code in your system, then it won't pull it and it won't rebill, and that's a problem. It'll suppress the claim because it can't find it. So just because CPT may have deleted the code as active for the calendar year 2025 doesn't mean it wasn't active at some point, and you still need to have it in your system. But just make sure if your coders are pulling it up, or you as a coder are pulling it up, that you see in the narrative it just says do not use and what the date is. Okay, so what are we looking at? So we not only have new codes, but we also have certain advancements in medical procedures and technologies. And we have a couple of different specialties that have been impacted and a couple that actually weren't impacted at all. And just remember, this takes effect January 1st, 2025. We've got 270 new codes, 112 revised codes, and 49 deleted codes. There's no code changes for anesthesia, respiratory, or auditory services. Most of the significant changes are, of course, to the telemedicine E&M services, skin substitutes, laboratory and path services, and yes, we've had some new technology codes in Category 3. And so this may not affect a lot of you, or you may have to look at some of the codes that may have been deleted. So let's start with E&M. So in the evaluation and management section, descriptors for the telephone services 99441 to 443, those were deleted, and they created a new family of codes for telemedicine services or telehealth. And we've got synchronous, which means real time, it's happening right now. Audio video starts at the 98,000 code to 98003. For new patients, for established, 98004 to 98007. Audio only codes, 98008 to 9800011. And for new and established, 90012 to 90015. And then there was a new code that replaced a G code for virtual check-in, and that's going to be 90016. And Medicare is going to allow for the virtual check-in only. But just remember that any of these new E&M services under telemedicine, telehealth, Medicare has said they're in an invalid payer. And I know I said I wasn't going to give you any Medicare, but I just want to make sure you knew that. Also check with your commercial plans, because I am not seeing policies where they're adopting the codes for audio only. They've already said they're not going to cover audio only anymore. Last year, I know United Healthcare said that. I know several of the Blue Cross Blue Shield companies said that. So just because a new code is created doesn't mean it's a payable code. Just means it's created for a new descriptor. So just be aware of that. The sections under the telemedicine E&M, it actually talks about based on either medical decision making or time. And it also, there's a new table in there to the subsection that clarifies the coding for the services when it's non-face-to-face or face-to-face. So just make sure you're aware of those codes. We hope that Congress figures it out so we can at least get something still covered coming in 2025. In the integumentary system, which is skin, okay, we have skin cell suspension autograft codes and skin harvesting codes determined by size, 15,011 and 12. We also have prep codes, 15013 and 14, and then also application based on anatomical site and size, and that would be 15015 and 018. In the musculoskeletal system, we had a metastatinal, lymphadenectomy code. Okay, MEDIASTINAL. I'm having a problem with speaking today, apparently. 21632 has been deleted, and now they have an editorial revision to an excision code, 21630 removed from the semicolon, making it a standalone CPT. Remember, sometimes I said some of the things are just semicolons or punctuation that change the meaning or how the code is used. So, but make sure you look. There's also some new codes for intercarpal and metacarpal joint arthroplasty with suspension, and then some transferred tendon codes. So make sure you're taking a look at that. In the cardiovascular system, I was really happy we didn't get too many new codes. Now they talk about this it's really cardiovascular surgery, so be aware of that. We've got a pulmonary valvotomy, 33471 has been deleted. Atrial septotomy and atrial septostomy, those were also deleted, and so they've had a lot more codes that were deleted in that area. Hemic and lymphatic systems and surgery, they added some new codes. 4 new codes were added for they call it the chimeric antigen receptor T cell therapy. So take a look at those starting at 38225 to 38228. In the digestive system, now this is for surgery, open approach. This isn't for gastro, so this is for general surgery. They've got some new descriptive codes at 49186 to 49190 for the intra-abdominal tumor and cysts using open surgical approaches. I'm sure you've heard cytoreduction or debulking. And these are based on the total length of the tumor or cysts removed or destroyed. So it's important to have that measurement taken in situ and documented in the operative report, because not only is the tumor or cyst measured, only the tumor or cyst is measured, not the surrounding tissues and margins like we do in some of the skin section when we do removal when it comes to excisions. And then also, if tumors arise directly from an organ or soft tissue, the appropriate organ or tissue resection code can be used as well. And they've added some of those, not just codes, creation of codes for that, but also some new language there. In the urinary system, you've got bladder incision codes that have been deleted. There's been some revised codes. in that area. Also some new codes that describe insertion of transurethral ablation transducers in the male genital system. They've got some new codes for transurethral ablations. In the female genital system, they have deleted excision of the ovary under the 58957 code, and in its place, they put in a parenthetical note for you to go to the general surgery codes for any kind of resection of the tumor, which I just mentioned in the general surgery section. So that was interesting. The endocrine system, we've got 2 new codes for percutaneous ablation of thyroid nodules. Both are specific to radiofrequency ablation techniques and thyroid nodules. But they only want you to report a second code only when additional lobes are treated. In the nervous system, they've got some new pain blocks. They call them extremity fascial pain blocks, and it's in the thoracic area and in the lower extremity area. And the codes specify whether these are unilateral or bilateral, and whether the block is administered by injection or continuous infusion, and whether they include image guidance or not. And it starts in the 64466 to 64474 range. And before I move on here, the CodeCast Podcast is brought to you today by Just Coding. That's your online continuing education destination. Pay one price and earn dozens of AAPC, ACDIS, and AHEMA credits annually. Save 10% off a new subscription using the coupon code SAVE10. Visit justcoding.com to subscribe. And just so you know, that is a Decision Health subsidiary. So in surgery, eye and ocular adnexa, code 66683, we have a new implantation of an iris prosthesis there. In radiology, we did get some new codes because in MR procedures, magnetic resonance, they can pose potential risk for patients with implanted medical devices or foreign bodies because that magnetic field can cause injury or death. So to ensure patient safety, these devices may need specific precautions, such as device reprogramming or positioning, depending on the implant's MR labeling and FDA-approved instructions. And so that's why they have new codes now, making sure that, for example, 76014 describes MR safety assessment by trained clinical staff. So they have a lot of these, and they are time-based codes. So you're looking at codes 76014 through 76019, and it just talks about the safety prep for that. And they are 51 modifier exempt. Path and Lab, not my specialty, but just so you know, there are some new codes for that section. There are 6, so make sure you take a look. In the medicine section, we have some new flu virus vaccine product codes, and also some new codes that talk about administration of the respiratory syncytial virus monoclonal antibody 96380 includes counseling. So some of these codes I've noticed now includes counseling. I thought that was interesting. And then in the category 3 codes, there's some new category 3 codes for emergent technology for subcutaneous peritoneal acetate pump procedures, and those are 0870T-0875T. There's some augmentative analysis of chest CT image data, and there's also for some percutaneous transcatheter therapeutic drug delivery systems, and that's in the 0913T section there. So make sure you take a look at that. I will have an specialty update. I know AAPC does everything. I don't do an everything changes every year. That's just too much information that I think some people are just looking for their specialty. And that's why I really like, saying, yes, I am a 14 credentialed person, coder, but I also want to make sure you know that I have specific specialties that I focus on. And so if you're looking for an update for gastro, that would be December 18th. I have one at 8 a.m. Pacific time and at 10 a.m. Pacific time for cardio through McVeigh Seminars. Take a look at that. And then I also have my fourth quarter Medicare update webinar, and you really want to see that because it's going to be a lot of information on telehealth, a lot of information from new Medicare regulation. So at 8 a.m. on the 10th of December. So actually, if you had a chance to listen to this today, you may have missed it already because it's 8 a.m. Pacific time, but hopefully you have already searched that out. If you missed it, I am also presenting another one for McVeigh Seminars at 10 a.m. At Pacific time on the 17th. And so just make sure you take a look and get all of those different webinars. I also have for another Medicare update will be coming probably in January. Also, I've had a lot of people ask me about my Coding Corner membership. I know we've had just a flood of members added in this last couple of weeks and last month, which has been great. And so, we've been around since 1992, so that's over 30 years. And it's just so nice to continue to have people that have stuck with us, that are just really like having an opportunity to ask coding, billing, and compliance questions and specialty questions through email. And we have that. You can go to terryfletcher.net. It's under services, the very first under the drop-down screen. You can see what that's all about. We have a regular membership at $1,200 a year and a executive membership at $1,800 a year, which has some additional benefits, newsletters, things like that. But a lot of you have been with me for at least 10 years, and it's just so nice to have the new people try it out and see if you like it. But remember what it is. It's, you come up with a coding question, you're thinking, oh, where do I go to find this? Do I have to go search the web, or do I have to try and, ask a friend of mine and bug them? Well, if you have a paid service, and again, it can be as little as $100 a month, we do ask for it a year contract. We're here to help. We're also here if you need, how do I appeal this? Can you help me with an appeal letter? Or are these coded correctly? Do I need a modifier? Or why can't I find the code for this? Something like that. Or is this a compliance problem? I have several physicians who have signed up that have basically said, I'm a cardiologist and I'm bringing in a dentist. Can I do that? Usually the answer is no, but I explain why. So a lot of questions, a lot of things, and we do almost 12 specialties. And I say almost because ortho, I do everything but spine. So, but I do have spine contact. So shout out to my good friend Stephanie Allard, who also has a membership and has just started her process and her journey into independent consulting. So we're excited for Stephanie to do that. She's a great auditor, and I love doing projects with her. So, and you've probably seen her and I both on the Compliance Guy Roundtable podcast, where we have 6 of us, including Christine Hall, and it's just very fun. But I just want you to know that, you look at our website, you can see on the About Us what specialties that that my company actually offers, and hopefully it can help you out if you're interested in that. So a personal tidbit this week. I don't know if you are reading any books right now. I know it's busy. It's December. It's holidays. It's month end. It's year end. I started a book in Hawaii when I went with my husband for our 25th anniversary and my birthday in October. And it's called The Senator's Wife, and it's really good. It's getting really good. So, I kind of like politics. I like well, I don't love politics, but I like the nonfiction political books. So if you are looking for a book, it's really good. It's just, it's by Liv Constantine. You can find it on Amazon. But it's just really good, and it has twists and turns, and it's not a slow read. That's one thing that's tough for me. It's a slow read. If it's a slow read, this is not. So it's nice just to get in, and if you can, just get in 30 minutes or 45 minutes a day of just reading that doesn't have to do with work. It's just nice. I mean, we all have our devices, and between our phones and our iPads and our TVs and catching up on streaming, and sometimes your brain needs a break from electronics and computers. You just need to dive into something that has nothing to do with day-to-day life, that is just a fantasy, I guess, departure is what I'm saying. So hopefully you have that opportunity. I love my Steelers, and we're now 9-3 with a big game coming up this weekend, but so we're top of our division. But I'm just really happy that I'm making time for some personal things that I stopped doing for a while. I had a book club and all that, and I'm just really a lot happier thinking about, I can't wait to get to page 112 to see what's happening. So on just a book that has nothing to do with work. So we all love our work, we love our jobs, but it's always going to be there. Think about when you go on vacation or you get sick or you take a day off and you come back. Did anybody do your work for you? No, it'll still be there. Take the time. And as we're getting closer to the holiday season, I just hope you're having a good time out there, hopefully getting some nice Christmas, Hanukkah presents, Kwanzaa presents, whatever you celebrate, and you're getting some time with family. All right, everyone, have a great rest of your week. Make it a great day, and thank you for listening to the CodeCast Podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter at TerryCoder1 or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.